Hello, everyone, and thank you for joining today's webinar. Please be sure to share where you are joining us from today in the chat, please. All right, we are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. No one with the ability to control content has had any relevant financial relationships. To receive contact hours for this NCPD session, participants are required to attend the webinar and log into our learning management system to complete an evaluation form. Information on how to access this will be emailed to all attendees 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. So please know, probably not this week, it'll probably be posted next week. Following the presentation, if we have time, we will have a question and answer session. You'll see on your Zoom webinar control panel that you can send a message through the Q&A feature. This is where you can type in any question you'd like to pose to the presenters. Be sure to hit send so that the message makes it to us. And please make sure that you use the Q&A for questions and the chat feature to interact with other participants, because we've all been using Zoom for long enough to know that once that chat starts scrolling, we're going to end up losing questions in that. So they'll stay put where we can see them if you put them in the Q&A. We would like to thank our speakers for sharing their expertise with us today. Of note, thoughts and views expressed are that of the presenter and do not necessarily reflect that of Sigma. Our speakers today are Amy Staley and Regina Yuen. Amy is an award-winning global nurse leader based in New York City. Amy is the patient care director of the Neuroscience ICU step-down unit at New York Presbyterian Hospital and Weill Cornell Medical Center. Outside of the workplace, she is proud to represent both her patients and fellow colleagues by multiplying and amplifying the voices of the nursing profession as a Sigma United Nations youth representative. In 2022, she spoke at the 77th United Nations General Assembly events, where she advocated for both vaccine and health equity for the United States and Africa, among other nations. Since this event, she has spoken in over 150 countries as a proud registered nurse. Some of her most noteworthy work has taken place in collaboration with the World Health Organization, Johnson & Johnson, Harvard University, ICN Congress, People Power Health, and the Africa CDC. Amy is proud to serve as a Sigma United Nations youth representative. And then we have Regina, who is a registered nurse from Canada and Hong Kong, who began her career in an under-resourced level 1 trauma emergency department in Detroit, Michigan. Since then, her career has evolved by working in public health in the Canadian subarctic, in emergency management with the Canadian Red Cross, and in the field in South Sudan with the humanitarian organization Médecins Sans Frontières. Regina completed a Bachelor of Science in Nursing at the University of Windsor and a Master of Public Health at Johns Hopkins University. She is a proud member of Sigma Nursing Tau Upsilon chapter. As the Sigma Nursing Youth Representative to the United Nations, she aspires to utilize her diverse experiences in nursing alongside her knowledge of policy, health system strengthening, and health and emergencies to advance accessibility to health around the world. She also aims to solve multifaceted challenges through the Sustainable Development Goals and to amplify and elevate the voices of nurses on the global stage. Welcome. We are so excited to hear you present today. And with no further ado, here we go.
So thank you everybody for joining us. It's so exciting to see that there are so many people joining us from all across the world. So Amy and I wanted to welcome all of you to our presentation, Better Together, a collaboration between nurses and global communities at the UNGA 80. So here are some of our learning objectives today. After attending this session, you will be able to describe the purpose of the United Nations Sustainable Development Goals, the SDGs, and be able to verbalize an understanding of how nurses can contribute to the SDGs, as well as to provide an example of how global nurses can collaborate with global organizations to impact advocacy and policy change from a local to a global scale. And so we're going to start off with introducing what the United Nations do. So they are an international organization that aims to maintain international peace and security, foster friendly relations amongst nations, promote international collaboration, as well as serve as a center for coordinating global action. So this encompasses areas such as peace and security, human rights, humanitarian aid, sustainable development, as well as upholding international law. As nurses, we work at the intersection of health and also advocate for human rights and equity. And so we work to humanize the experiences that our patients have within our care. Within the UN organizations, they provide coordination, aid, and assistance efforts to be delivered to areas that need it most. As nurses, we also contribute to humanitarian efforts through providing care and advocating for medications and essential supplies to the most vulnerable settings. While this can be international, it can sometimes be within our own communities. So, while those who work at the UN don't always wear scrubs like we do, our voices as nurses are essential to their overall mission. As you can see from this slide, United Nations is broken up into 6 principal organs within their system. So first is the General Assembly. The General Assembly consists of councils, committees, funds, and programs such as UNICEF that you may be familiar with that provides aid to children all around the world. It also has research and training programs in areas that work on managing issues like global conflict as well as gender equality. The Security Council focuses on peacekeeping, counterterrorism, as well as global security measures. The Economic and Social Council focuses on economic growth, social development, crime prevention, as well as environmental protections. The Secretariat comprises of a number of different departments and offices that focus on specific global issues, and the last 2 organs are the International Court of Justice as well as the Trusteeship Council. So you may be wondering, where does health fit into all of this? In the specialized agencies in the blue there to the right, you can see that there's the World Health Organization, which oversees the world's current and emerging health challenges. So who is missing? It's crucial that all of these organizations and agencies collaborate to ensure that we live in a just, safe, equitable, and healthy planet. This is where you come in. And so your voices are invaluable. As the world's largest healthcare workforce and most trusted profession, we need your advocacy and compassion every single day to drive these efforts, and you fit into this overall picture. Next slide, please. So, ECOSOC stands for the United Nations Economic and Social Council, and this is how Sigma nursing engages within the UN mechanism. So the ECOSOC deals with economic, social, cultural, and health matters, as well as human rights and fundamental freedoms. A number of organizations across civil society holds the ECOSOC consultative status, which gives them the privilege to serve as experts within their field as well as assets within the UN. In July of 2012, Sigma was granted special consultative status for our expertise within the field of nursing as well as global health. Next slide, please. So what's our role within Sigma's global health team and UN team? We want to represent you. We fulfill the mission of Sigma by representing the voices of Sigma's nursing leaders and provide expertise through global health, public health, and global interprofessional conversations. We also promote advocacy as a skill for translating our local efforts into global results. We advocate on behalf of health for the role of nurses and provide our perspectives into all policies. And we also inform our members and we help our nurses better understand the SDG and the relevant help of UN. So, of course, we also provide expert analysis. All of this is in order to advance the UN goals and objectives. And we submit written and oral statements concerning nursing and global health across a number of sectors in order to do this level of advocacy. And we build partnerships between Sigma and other NGOs, academic institutions, and also like-minded communities, individuals, and organizations as a group effort. So there are many topics of what we do, but what we do is also in support of the United Nations Sustainable Development Goals. So next slide, please. This is always a gorgeous slide with all these pictures. This is the United Nations Sustainable Development Goals, or SDGs. And so while these goals are listed separately and seem like completely different sectors, they all intersect. And as nurses, we contribute to many of these. So these goals were adopted by the United Nations in 2015 as part of the 2030 Agenda for Sustainable Development. In addition to these 17 goals, there are also 169 targets that are not listed here and that are sub-goals to each box that you can see. So Which goals here do you think are targeted towards nurses between 1 to 17? Of course, as you can see, SDG 3 of good health and well-being is specifically targeted at ensuring healthy lives and well-being for all. We highlight this as nursing play a key role in achieving all 17 goals. And as we had said before, not many nurses are aware of how we can play a role within SDG. Within a recent scoping review on nursing, Fields et al. Had found that many nurses are not familiar with the SDGs and don't really connect them to their everyday practice. So, within this past year, the UN team we have intentionally increased our efforts to more broadly communicate our daily contributions to the work and the goals of the United Nations. And this has resulted in multiple presentations, keynotes, publications, webinars, as well as social media posts to better broadcast this effort. Next slide, please. So here's our team. We are comprised of 9 United Nations representatives. And so this is the UN team on behalf of Sigma Nursing, also known as the Global Health Team. We also receive support from our Chief Nursing Officer, Dr. Sarah Gray, as well as our CEO, Luke Davis. And so please visit this link here so you can read more about the bios and the expertise of what each liaison and youth representative do. And we also would like to advertise that applications are currently open to become a UN liaison and a youth representative. And so applications are due November 19th. And you're welcome to ask us any questions about the process here and to also approach us individually. Next slide, please. So, this is the power of nursing at UNGA 80. So if you can see from some of these pictures, we were well represented in terms of the high-level meetings, the side events, the general debate, and it's also very, very exciting to be in New York City during this time. It is buzzing with events. So here you see some pictures representing, of course, General Assembly and high-level events, which we just discussed, but also side events that are held by partnering NGOs, academic institutions, and private sector organizations. It was also Global Goals and Climate Week, so there's a lot of events that are intersecting during this time. We did want to highlight an event that was held by the International Council of Nurses and NYU, who featured our very own Jerry Owner, you can see on the bottom left there, who spoke about what we do as part of the UN team and how he contributes to ensuring health is upheld through his research and his own work benefiting global communities every day. So, how does this elevate the nursing profession? And why is it important that nurses are at the UNGA? So it is crucial that we are there not only to lend expertise when it comes to events regarding health, but also all of the sustainable development goals. For example, I had attended some events within both Global Goals and Climate Week, and here are some of the things that we were able to discuss across sectors. Within Climate Week, we discussed how warming climates impact humanitarian crises and increasing natural disasters, and how nurses must respond in terms of preparedness and what it looks like in terms of international emergencies. Within Global Goals Week, we also highlighted how inequities like gender equality, lack of education, and unsafe environments impact our global communities and patient populations, leading to worse health outcomes. How about you, Amy? What is it that you thought was really important, and how can we highlight the power of nursing at UNGA 80?
Yeah, thank you so much, Regina, and thanks for such a great introduction to this conversation and for kicking it off for us. As you guys can see, a role like this to be a Sigma United Nations youth representative and a Sigma United Nations representative, this extends far beyond Regina and myself and even the other nurses that you can see here in these photos. I think that one global peace advocate described it best at the UN when he said, "The UN is not a monument, but a mirror, a reflection of what we pour into it." And I think that our profession also echoes this sentiment. So I first attended the United Nations General Assembly events in 2022, and each year I've been lucky enough to have been invited back by several different organizations. However, this year my experience was entirely different. So this was my first time attending the UN events on behalf of Sigma, and I can truly say that I have never felt that my voice was so valued or that my presence was so respected. And I think that I'm sure many of you who have joined this webinar today are nurses or nursing students, and we're always looking to find organizations that are well respected and to immerse ourselves in. And I can truly say that Sigma definitely is that particular organization in this space at the UN. Last year, I was fortunate enough to bring 3 nurses with me from my hospital, New York Presbyterian Weill Cornell. And we were really, really excited. And this year, I was fortunate to double that number thanks to the World Health Organization, the Gavi Vaccine Alliance, the World Bank, and a few other amazing partners. So in this photo on the top left here, you'll see my colleagues, my amazing frontline nurses here from NYP Weill Cornell with leaders from the WHO, the London School, Gavi, and World Bank. They not only included but valued the perspectives of our nurses while facilitating this discussion on building momentum for non-communicable diseases, which was really amazing. NCDs, or non-communicable diseases, were a huge item on the agenda this year. So currently, NCDs are responsible for 70% of deaths. However, they only receive 1 to 2% of funding for prevention. So as you can imagine, that really prompted leaders to create something to change this. So the individuals pictured here are nurses were actually privileged to get the firsthand look at this NCD report before it was even presented to presidents and leaders at the UN just a few days later. And I think that because of these organizations like Sigma and all of these other partners, they know how important it is to include our profession in these discussions, and that truly made a difference this year. As Regina mentioned, Jerry's event was also really incredible. Jerry is the most amazing professor from California, and he was able to share his knowledge with some other really incredible leaders over at Rory Myers College of Nursing, NYU, another really great supporter of Sigma Nursing and all of the work that we do. And, it's important for us to advocate and speak, but it's also important for us to show up. I think that our presence itself at the United Nations is powerful for these leaders to see. And the fact that presidents and world leaders are getting used to seeing us there really just shifts the culture and changes the narrative in policy change to ensure that we are at the forefront of these agendas. And with that, I will pass it back over to Regina to talk to us about the high-level meeting on NCDs and mental health.
Completely agreed with everything that Amy said. Thank you so much. And so, of course, having our voices as, again, the largest healthcare workforce in the world and utilizing our lived experiences is crucial when it comes to high-level meetings pertaining to health. And so, as you can see from some of these photos here, we had Dr. Tedros, the current Director General of the WHO, the World Health Organization, who was quoted saying that he asked all countries to integrate services for non-communicable diseases and mental health into a primary health care at the foundation of universal health coverage. And so being present at these events is really, really crucial to lend our voice and our lived experiences to member states, to international NGOs, and also grassroots organizations on the ground. So it was very exciting for NCDs and mental health to be the focus this year because for so many years, the focus had been on infectious disease, which of course are also extremely important. However, according to WHO, like Amy was saying, the mortality for NCDs in 2021 was 43 million people. So close to three-fourths of all deaths globally. Well, these deaths are also disproportionately impacting low and middle income countries, with 73% of these deaths representing LMICs. So it can no longer be ignored or sidelined. As we know, mental health is a topic that continues to be stigmatized, with 1 billion people living with mental disorders, and representing this as 8% as children and 15% of adolescents. So as we know from our day-to-day work that these are very, very vulnerable populations, and we have to represent these global communities at the heart of what we do. So as Amy had alluded to, some of our roles at these meetings, of course, is to share this evidence-based data alongside our lived experiences to drive home the importance of these topics. For example, when we submit our written oral statements, it's also very, very important to highlight some of these statistics. But as we know, a lot of these reports are published, and a lot of these professionals in the room know these statistics. What we do is that we bring our perspectives within nursing to elevate and amplify the voices of these communities. So something that I had discussed was that when I was working in a high-income country, I was working in a very, very low resource setting. There was a father of two who had come into our resuscitation room in the emergency department, and he has asthma, and he was not able to get access to his inhaler because of the cost for almost 3 weeks. Alongside, this was in a setting in Detroit, Michigan. We have a lot of manufacturers around, and we are known for our poor air quality. Alongside of all of these factors, unfortunately, he had to be intubated. And so we understand that impact of how these preventative factors can contribute to emergencies that lead to worse outcomes, that leads to very, very high impact to not only that person's life, but also their family and their community's life. So it's very, very important to highlight these concerns that are happening in the real world that we are seeing. Alternatively, I also highlighted some of my experiences in the humanitarian sector. As we know, cancers are also very, very important of the NCDs. And within the humanitarian setting, people are just fighting for basic accessibility to health services, with specialized services like oncology and palliative care often missing. And so, unfortunately, within this setting, a mother of three had to be considered a palliative care patient because we didn't have access to oncology services after we diagnosed them, or the clinicians diagnosed them with cancer. And so these are what we're seeing every single day. And from all of these organizations, we have to bring these stories to the forefront to highlight this is what's happening on the ground, regardless of the setting that we're working in. It is also crucial that we're present to learn about what different member states, UN agencies, international and grassroots NGOs are doing. And so we know that our presence is very, very important to be at these events. And we also need to form partnerships because we know that nobody can solve these very, very complex challenges alone. Lastly, we also want to be recognizing and thanking allies. So, multiple member states and international NGOs had mentioned the importance of nurses when it comes to NCDs, when it comes to education, coordination, and treatment across communities all around the world. And so, some of these include Dr. Tedros, Permanent Mission of Switzerland, and several other international NGOs. And so, we always want to be able to go up to them, approach them after, and say, thank you so much for being our allies. Thank you so much for your support. And what you're doing is really helping to amplify our nurses on the global stage. And lastly, we also attend these events, so of course we can disseminate these findings to you, our members, and we hope that you keep in touch and you continue to follow our journey along the way, and that one day you will join us. Next slide, please. So these are also some pictures of the general debate, high-level meetings, and also side events. And so when we watch the general debate, we can also watch different member states deliver their statements and assess what their priorities are. And so our global health team is actually comprised of members from all over the world. And so you can see within our bios. And so it's always exciting to attend sessions that your country is speaking at. And you can go ahead and log on to UN TV actually to follow along what your country is saying. Part of amplifying and elevating the voices of nurses is also to support our nursing colleagues. So as you can see here with the top left picture and the bottom right picture, I try to read through a lot of these events and the panelists that will be there and present to support our colleagues. So these are colleagues that are at the International Council of Nurses, and of course, some of the other panels that encompasses international NGOs. We are also learning at these events, right? These are former heads of states, prime minister and presidents, ministries of health who have a lot of wisdom to solve, that have solved problems and is willing to continue to solve emerging challenges and provide their expertise. And so we must note that a lot of these events are also available virtually, or they'll be sharing the recording afterwards. So I used to think that New York City, it's so far away, it's so expensive, there's no way I can ever take parts of this conversation, but you can. So even if you cannot be present in New York City, you can actually take part of the conversations online when they share these kind of broadcasts, and with some events even allowing Q&A. So from your computer, from your chair, wherever you're sitting, you can take part of these conversations. Over to you, Amy.
Thanks so much, Regina. It's so fun to hear about everyone's experiences, because even though we're all in the same place, there's like hundreds of meetings going on at the same time. And it's so interesting that like we were able to go to such different things and have such different experiences at one universal event. So this was one of the events that I went to, the United Nations high-level meeting on women. So many of you might also love Beyonce. I love that song where she says, you know, who run the world? Girls. And but girls actually do not just run the world. They run countries, healthcare systems, entire professions, and actually the United Nations General Assembly. So the United Nations High-Level Meeting on Women was convened to recognize the Beijing Declaration and Platform for Action to Achieve Gender Equality and the Empowerment of All Women and Girls. As one speaker proclaimed, China holds up the whole sky when it comes to gender equality and women's rights. So they really championed and spearheaded this event for all of our countries to attend. UN president, also one very powerful woman, Annalena Baerbock, she made a powerful speech of her own before giving the stage to 193 member state representatives. Each person had 3 minutes each to speak. And of these 193 member states, nearly every single speaker was unable to abide by that really strict 3-minute speaking rule. And after the first 20 or so leaders required their microphones to be silenced, I realized that this was not a coincidence, but rather this symbolic, almost confirmation that women was so crucial to this year's agenda. The fact that nearly every world leader would and could have continued speaking about the importance of women's rights, women in leadership, and gender equality for these minutes, hours, days, both literally and figuratively, really just symbolized its purpose here at UNGA 80. I would say that oftentimes at the UN, this is kind of how topics are so loudly amplified by these quiet, often like almost subtle gestures, right? It's not always like a protest or a revolution that shakes the narrative there. Sometimes it's a woman, a nurse, or a speech just that lasts a little bit longer than 3 minutes. And there were also a few statistics that I believe really solidified this purpose on the agenda that I wanted to share. So here's just a couple of them. Today, more than 600 million women live among conflict. 1/4 of women around the globe are unable to make decisions about their own health care. While many women spoke at the UN this past week, while Regina and I were there in 2024, just last year, less than 10% of speakers at the United Nations General Assembly were women. As of today, there are only 29 countries where 32 women serve as heads of state and or government. So statistically, for my data people in the room today, at the current rate, gender equality in the highest positions of power will not be reached for another 130 years. So this conversation was started by world leaders at the United Nations General Assembly, but as we can see, it needs to be continued by nurses all around the globe. Gender equality and women's rights are not an option, but an obligation that we hold to each other, to the patients that we serve, to the communities that we live in. And as nurses, it's our job now to take action to ensure that these statistics are better reflected next year, and so that we can be proud to share those statistics at next year's meeting. So here are some photos. Our colleague Siobhan is also over here on the right, Siobhan O'Connor. She's another United Nations representative, super powerful. She's doing a lot of really great research right now, so I would definitely recommend connecting with her on LinkedIn as well. So presidents, ministers of health, excellencies, and nurses at high-level meetings. During my time at UNGA 80, I was fortunate to attend the first high-level debate to hear from several presidents and world leaders across of our nations. So for those of you who live in New York, or maybe who have like been to things like this, heard about the UN before, this is that one day that you've all heard about where all the streets shut down. There's gridlock everywhere. I saw videos last week of like presidents not even being able to cross the street. Like nobody can move. It's just that one day where it's for the presidents, or so that's the misconception, right? So everybody thinks that that one day is for the presidents, but it's actually not. It's for you guys. It's for us. It's for people. It's for humanity. And for a room full of world leaders pictured here on the left, most of them are down on the floor in that photo. I have to tell you that when nurses step into these spaces, the power actually shifts. So while I was not speaking publicly on this date, I was seated in what I believe to be the best area in the assembly, which is the family and friends cheering section. And for those of you who know me in real life, I was born for that role. Everyone got a standing ovation, I can promise you that. And although I wasn't speaking, I wanted my outfit to fit the part. I'm sure as you saw at the last slide, I put a lot of thought into what I was going to wear. New York Fashion Week just passed. Here at Weill Cornell, we actually held a fashion show with scrubs for our nurses. So I knew I really needed to fit that part for Sigma. So I wanted to make sure that I had a purse big enough to hold the purpose of the 100,000 Sigma nurses around the globe, many of you who have hopefully joined us today. I wanted to have shoes comfortable enough to stand on the promises that I and the 4.7 million nurses throughout the US have made to ensure that all of our patients are treated equally. And of course, a dress long enough to symbolize the road we've traveled, the road that we have ahead, and really all that we need to do to pave the path towards universal health care for our patients all around the globe. And I think that the audacity that both Regina and I had to walk into these rooms as nurses jingled in my bag like spare change throughout the entire week. While I didn't do a traditional fit check as many influencers would have, I'm definitely a wannabe influencer. I'm certain that as a Sigma UN representative, as Sigma members, every single one of us has influence when we walk into these spaces, and every single one of us fits into these spaces. So outside of my Sigma role, I manage a nursing team here in New York on a neuro unit. And one thing that just amazes me about neurosurgery is that every single person who works in neurosurgery believes that all things are worth pursuing, even when the outcome is uncertain. Our nurses care for the rarest conditions every single day, every last patient, giving everyone a chance at a hopeful future. So why wouldn't we do the same in policy that we do in these hospitals? Um, I might have spent most of my week sitting in the family cheering section, aside from my standing ovations, but make no mistake, despite sitting there, I made it very clear in my conversations that I stood for something, for our profession, for our patients, for the rights to all of our patients to receive healthcare. And of the 193 member state presidents, ministers of health, excellencies from all over the world who spoke, we all shared one universal message. And that is the same that Regina and I are sharing today, that we are better together. Agendas for our countries all shared common themes. So some of those themes were peace, development, and human rights. Many committed to solidarity for our people, for our planet, commitments, of course, to our SDGs that Regina talked about earlier. Our presence in leadership roles is needed now more than it ever has been as nurses. The lives of our patients depend on the amplification and elevation of our profession from hospitals, from communities, and even from the family cheering section at the United Nations. In addition to these big rooms, and in addition to the United Nations General Assembly, Regina and I are privileged to attend so many other amazing events because of Sigma and on behalf of Sigma. So I'm just going to give Regina a quick moment to speak about some prior engagement that she's also had the opportunity to partake in.
Thank you so much, Amy. Can we all agree that she is an actual influencer and not a wannabe influencer? You all saw what her engagements and what all of that passion looks like and accumulates to, and that standing on behalf of our profession, standing on behalf of what it means to be a nurse, and standing on behalf of what it means to provide care to these communities so that we could elevate their voices when it comes to the global stage. And so we have been very, very privileged, as Amy was saying, that to be just attending events beyond just New York within the UNGA. So some part engagements I have been a part of is the Partnership Forum in February, and we had spoken about how, in terms of SDGs, goes beyond health and what it meant to connect at the forefront of beyond just patients, but what it looks like to be going beyond engagements at just the UN, but bringing things back down to a grassroots level and how we can connect within communities, private sector, NGOs, member states, and to ensure that everybody gets the healthy and just life that they deserve. I was also part of the Commission for Social Development. I had represented alongside Aimee Horcasita at the Youth Forum, and I was lucky enough to speak at the Humanitarian Affairs segment. As you know, after working in the humanitarian sector, this is a topic that's very, very close to me. And on behalf of global communities, it's very important that we highlight these experiences because we know they are one of the most vulnerable populations in the world when it comes to access to healthcare. And so, being at the UN beyond just New York, but also being in Geneva, I had also attended the financing for development in Sevilla in Spain. You might ask, what's a nurse doing at a financing conference? What do we know about money? Well, as we know, when it comes to working at the policy and advocacy level, it goes beyond just, of course, we're humanizing the experiences, and it's very, very important to bring this level of discussion to this table. But beyond that, we also have to connect a lot of these social problems because they don't see nurses at the forefront. And so part of our presence being there is to say, we are connecting youth, we are connecting climate change. We are connecting health financing and what the return of investment is when member states invest into their ministries of health, invest their budget and parts of their GDP into healthcare, and what that means for better health outcomes, for stronger economies. And especially part of the Gender Equality app is that we know that women run economies. And the majority of nurses also encompass being women, right? And so whenever we look at the intersections of these inequities and what these gaps means, we are able to influence policy at this level to say that these issues are all interconnected and here's how nurses can play a role. Back to you, Amy. Your mic, Amy.
Classic. Thank you. I'm sure that's relatable. I feel like we all do that a few times a day. Thanks, Regina. I was just saying that in addition to, the UN General Assembly, there are so many organizations that you can be a part of, so many things that you can go to that Regina has mentioned. And we'll share some more links and additional opportunities at the end for those of you that have joined that are interested. So some outcomes that we will accomplish together, I think the things that we will accomplish together are truly immeasurable. We can all agree on that. But just to name a few, advocating for non-communicable diseases and mental health, as we mentioned, that was such a huge topic this year. We have a link here to the political declaration on NCDs and mental health, which was released this past week. From world leaders, it focuses on several topics. A few of them are the COVID-19 pandemic. Oral health was a large topic this year as well. I did see a lot of dentistry organizations doing some different things. Lung health, childhood cancer is always a big topic as well. Liver disease, kidney disease, expanding environmental determinants. Some of our friends over at ICN are doing a lot of work with that. Air pollution, clean cooking, lead exposure, hazardous chemicals, digital harms, AI. Benefits of AI, excessive screen time, misinformation. The list goes on. So I would definitely recommend taking a look at that declaration if you're interested in hearing about all the different topics from this year. Together, of course, we'll continue to advance the nursing profession and strengthen the amplification of our global colleagues. So sharing knowledge with other Sigma members, I'm sure many of you have joined this webinar today because you are proudly a part of Sigma as well. So just a few ways that you can share your knowledge and look into what others have done. You can look at publications, the American Journal of Nursing, Journal of Nursing Scholarship, the SDG month toolkit on the Sigma website is really helpful as well. I've seen a lot of Sigma chapters do some really cool events and kind of like volunteership opportunities surrounding the SDGs. So that is something really exciting to look into as well. Presentations at Sigma events, the conference coming up in Indianapolis. We are all so excited. Regina and I will both be there in November. So I really hope a lot of you are attending. It's going to be really amazing. There's a lot of really amazing things planned for November. Chapter induction ceremonies, regional events, meetings, Sigma webinars, and of course, one-on-one interactions with Sigma members. I already saw a few people share their LinkedIns in the chat. So a great way to stay connected. This is probably one of my favorite, if not my favorite opportunity that Sigma offers. So it's the Sigma Virtual Mini Academy Global Advocacy, Unlocking the Power of the Nurse Advocate at the United Nations. So this provides nurses an opportunities to advance their advocacy roles in healthcare. We have the power to be excellent advocates, of course. And through this project, or through this program rather, it's 6 weeks. You get connected to nurses all throughout the globe who share similar interests to yours. And then you're provided with an opportunity to create your own initiative and have the opportunity to submit that to the Sigma repository. You can put your initiative into action and actually pursue it in real life. I was able to do an amazing initiative to serve unhoused asylum seekers here in New York City with a nurse practitioner that I met because of this program. I was able to gain more interest and kind of information on the UN role through this program as well. So if you're thinking like you want to apply for this role that Regina and I hold in the future, I would definitely recommend going through the Global Advocacy Academy. Really, really great resource and definitely very affordable as well for Sigma members. These are some resources that Regina and I just wanted to share with you so you can learn more about the UN, you can learn more about the SDGs, you can participate in UN briefings. Once in a while, there's an opportunity to submit something to speak. Sometimes it's cool just to hear what others have to say. You can keep track of UN events here, plan a visit to New York, come visit, I'd love to meet you. And you can do a tour, a briefing by a UN official. It's a really cool campus, really cool grounds to look around on throughout the year, all year round, not just in September during the General Assembly. And then, of course, there's some mailing lists as well out there that you can sign up for. And here is our contact information. I hope that when you listen to this presentation that Regina and I delivered today, that you saw a piece of yourself in these photos as well, because it's really all of us that are making such a global impact. And if you have any questions, we do have some time left, and you can please feel welcome to reach out to us one-on-one as well if you're shy and you don't want to bring something up today. We're very responsive. We would love to share more with you, especially if you're interested in applying for one of the open roles coming up. So thank you guys so much for joining us today. And we look forward to partnering with each of you to make our health better together for the future.
Thank you so much to our presenters today for all of this great information. Sigma is grateful that you took the time to share with this audience and look forward to hearing more from you guys in the future. We are going to place a link for your contact hours in the chat. We hope that you've enjoyed this webinar. I know that I certainly did. I had no idea, and I work at Sigma, I had no idea all these amazing things were going on, so that's great. To complete the evaluation and obtain your NCPD certificate, please click the link we have just posted in the chat, and Monica will continue to post in the chat so that you guys have an opportunity to obtain that. However, if you are unable to grab it out of the chat, please know that I will be sending out an email next week with links for the repository link and also this evaluation link so that you can go ahead and obtain your NCPD certificate for your contact hours. Do we have any questions? Okay. For a nurse that is starting their journey in global health, what is the best advice you would give for their first steps?
I can start if you want, Regina, and then pass it along to you if you have anything to add. Regina and I actually both got some advice this past week when we were at the event at NYU Rory Myers College for Nursing. One of the professors there had mentioned to us that the best thing you can do when you're looking to get involved in global health is to just say yes to everything. So if somebody asks you to be a part of something, if somebody says, hey, Clarissa, we're doing a project on climate change and how nurses can assist with sustainability, even if you really don't know anything about sustainability, join, like say yes, get yourself involved, immerse yourself. I will also say just connecting with these organizations that do so much for nurses on the global scale. Sigma, of course. Nursing Now is another really wonderful organization, whether you're a nursing student or a nurse, to get involved in. Johnson & Johnson does a lot of community work on the ground for nurses. So I would definitely recommend just making as many connections as you can and always saying yes. But Regina, please add anything else.
That is great advice. I was always told also by a colleague to say yes to life and just always take every opportunity at its helm. In addition, when I was starting out as a nurse, it was difficult for me also. I was growing up in a smaller city, and so how had really been confused as to how to get connected in a global setting when I was just sitting within my own community. But some of the advice that I've gotten from just nursing colleagues and also global health colleagues was to look into our own backyard, right? And so I know when it comes to working in a lot of these global global events? How can we make a bigger impact to life? But some advice I had gotten from the Canadian setting is to work with our populations as well that are really disadvantaged, right? And so for me, that was working with, again, Indigenous populations in the Canadian subarctic, and to look at how this can contribute to the conversation globally from a local lens to a global lens. And you're able to now utilize those experiences and also share amongst yourselves within global communities that also work in those settings. And I would say that if you're not familiar with a lot of this landscape, you can think that, oh, global health, and even within my daily clinical practice, I'm so focused within this one arm or one lens within nursing. I was able to look online to a lot of these courses like Coursera, what they called MOOCs. These are courses that are available free of charge to anybody, so you can learn more about public health, learn more about global health, and even learn more about the UN. The UN also has these free trainings. So definitely do a lot of searching to find what your passion is and how it can align within nursing.
Wonderful, thank you. Does anybody have any other questions for Amy or Regina? They did such a great job kind of summing everything up. All right. Well, we do not have any more questions right now. However, Regina and Amy have both shared with you their LinkedIn contacts as well as their emails, so that if you want to go ahead and connect with them one-on-one privately, you have the ability to do so. As I've already said, please expect next week for an email to come out to you that will have both the repository link to this recording, and that link will also have this PowerPoint uploaded onto it. And again, the evaluation link so that you can get your contact hours. Thank you so much and have a wonderful day.
Thank you so much.